Hello, folks. Welcome. We'll be getting started a few minutes after 1. We're just giving a few minutes for folks to join. Hi, folks. We'll get started in about 2 minutes. Afternoon, folks. Thanks for joining us. We'll be starting in about 1 minute. Okay. We're at 1:03, so I'd like us to get started here so we have plenty of time for questions and conversation afterwards. So good afternoon, everybody. My name is Alex Marshall. My pronouns are she, her. I'm the Strategic Initiatives Officer for the College of Health Sciences, where I do work on things such as EDI, really related to this topic. Welcome to the webinar series EDI in Action, Advancing Research with Women and Children, jointly hosted by WICRI and the College of Health Sciences. The Women and Children's Health Research Institute, or WICRI, is a partnership between the University of Alberta, Alberta Health Services, Stollery Children's Hospital Foundation, and the Alberta Women's Health Foundation. I would like to thank the Stollery Children's Hospital Foundation and the Alberta Women's Health Foundation for making this webinar series possible. I want to start us off by respectfully acknowledging that the U of A is located on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant community. We honor the profound wisdom, knowledge, and experiences of the Indigenous peoples who have been stewards of this land since time immemorial and whose teachings continue to illuminate the path forward for our sacred responsibilities as researchers now and for generations to come. So we gather today during a time of significant social debate about the role and value of diversity initiatives. In this charged political climate, we recognize that meaningful research progress depends on diverse perspectives and experiences. As a research community, we therefore really need to actively work to address longstanding inequities in who conducts research, whose questions are studied, and who benefits from scientific advancement. Through these sessions, we aim to provide practical strategies and thoughtful discussions that help us collectively build a more inclusive research ecosystem, not just because it's the right thing to do, but because diverse and equitable research environments produce better science that benefits everyone. So thank you so much for participating in this important conversation. I am very pleased to serve as the session's moderator for today's presentation, which will be recorded. Stephanie Brooks will answer questions after her presentation concludes. You can type your questions into the chat function at any time or ask directly by using the raise hand function during the Q&A. And now I'm pleased to introduce our speaker, Stephanie Brooks. Stephanie Brooks is the Program Officer, EDI, in the University of Alberta's Office of the Vice President, Research and Innovation. In this role, she helps researchers strengthen the EDI components of various grants and awards. She also works to centralize EDI resources across campus and support the development of researcher competencies in applying EDI principles. Brooks is a PhD candidate in the School of Public Health and has been a member of the U of A Health Sciences community since 2011, focusing on knowledge mobilization and implementation science. And now I'm going to pass it off to Stephanie.
Alex. Yeah, so thank you for such a kind introduction. I was really excited to be invited to talk with Rick Whitcree for this series about EDI and research. I've been a Whitcree funded student in my master's. You've always done such high quality work in this community, so I am thrilled to be here supporting you today. So I have a presentation that I'm going to give. It's about 20 minutes, and then we'll have lots of time for Q&A. So, and I'm happy to answer whatever questions come up about incorporating EDI into your research grants. So let me get my presentation up here. Oops, is that the right one? So I'm here to talk really about the tri-agency grants, CIHR, SSHRC, and SSHRC all kind of follow a standard tri-agency purpose for their EDI components of their grants. So here are their commitments for EDI. They're looking to support equitable access for funding. They expect EDI to be incorporated throughout your research because, as Alex said, EDI strengthens research quality. They want to fund researchers who lead their teams in equitable ways by granting equal opportunities and the highest respect to their staff. And they want to use EDI findings from research to inform decision making. So these are really the types of things that will be in the selection committee's minds because it's part of the mandate of the tri-agencies. So for a really quick overview of equity, diversity, and inclusion, equity is really about, it's a way of working. It's about fairness in access and the opportunity to succeed. To engage with equity work is to recognize that systemic forms of marginalization exist and to be committed to dismantling these systems. In research, equity really begins by identifying the structural barriers within a particular discipline. So whatever those barriers are in your field within the broader health services, health research discipline, then committing to concrete actions intended to remove those barriers so that historically excluded or equity denied groups have full access to meaningful opportunities. And for researchers specifically, EDI is also about designing our research to reflect and benefit our diverse Canadian population. So diversity is the different human characteristics, conditions, and features that lead to different life experiences and needs. In research, diversity refers to differences in demographics, levels of experience, social identities, and perspectives. So part of committing to EDI is to value these differences and to understand that diversity will strengthen research by incorporating different backgrounds and perspectives. Inclusivity is really the process of meaningfully engaging with individuals from all backgrounds, including those from equity denied groups. So in a research context, inclusion entails ensuring that all of your research team members are meaningfully engaged, that they're represented throughout the research process, and that they benefit from the research process and results as well. So diversity and inclusion are really two components that make up equity. When we value diversity and commit to inclusion, we can work towards removing those barriers that deny different groups justice and success. I feel like of all the groups that I could present to, WICRI doesn't really need an education about how EDI shows up in health research, but I'll do my due diligence here. EDI in health research strengthens research questions and the interpretation of the results by incorporating diverse perspectives. Incorporating EDI expands research benefits to underserved populations, such as women and children, and it creates evidence to underpin changes that encourage more equitable health and social outcomes. So, especially here in the WICRI community, there's already so much high quality, high impact, high benefit research underway. Incorporating EDI is likely not about changing the narrative around your research completely. Rather, it'll be about showing that you're working in a way to cover all of your bases and to know that you're creating the broadest impact that you can through your research. And you're likely already doing a lot of this work. So this presentation is really about helping you articulate these elements in your work as you put together grant proposals. So in health research grant applications, you may be asked to comment on your EDI actions in your research environment or team composition. Both of these terms refer to how you run your lab or your office. You could also be asked to talk about how you incorporate EDI into your research design. For health research, this is really about asking how your research is designed to positively impact Canadian society, including marginalized groups. So people are often far more familiar with EDI in the research environment. So I'm going to start with EDI in research design. So remember that in health research, EDI is about creating projects that close the gap between well-served communities and underserved communities. So to do this, I suggest following three questions when you're putting together your research designs. So the first one is, if I finished this project as currently designed, who would benefit? And then from here, you can kind of see who might be missing out. And it can help you consider what additional elements to this research design could we incorporate to maximize benefit across different populations. For example, in Alberta health research, we'll often be working to serve people across the province, not just in urban centers. So having an eye to that final implementation to say, how can I develop this intervention or how can I develop this knowledge so that it can be used for both rural and remote and urban populations? Other questions are, how can this project reduce systemic inequities? And how can this research challenge existing social and economic disparities? And here we're talking about how health promotion and healthcare impacts people's day-to-day lives. Will your intervention help to create policies, procedures, or processes that are accessible? Will it make healthcare or health promotion more sustainable? Will it improve the quality of life for Canadians? If so, which ones? And again, who may be left out? And is there a way to make this system available to those people who are currently being left out too? If you can answer these questions and really think through them and incorporate your thinking into your grant application, you'll have a really strong research design, both from an EDI perspective and scientific perspectives. So here is a flow chart with some really nice prompts to help you articulate your EDI considerations in your grant applications. And the organizers are going to be sharing the link to this recording, so you'll have all of these slides. This is from Women in Science and Engineering Atlantic, and it also has pieces. So this is the kind of algorithm that they've put together for incorporating EDI in research design, but they also have algorithms for diversity and inclusion and equity in training environment too. So it's a very nice tool. I'll put the link into the chat during the Q&A. But really what this helps you do is to start with a question like, if I fail to consider diversity of populations in my research, could that affect my results? Yes or no? And then you can talk about why or why not, how you've done this thinking, why it matters for your grant application. So it just helps to really think through what the adjudicators are going to be looking for in your EDI decisions. This is another list of questions that I love. It was developed by the Research Partner Network here at the U of A. And these questions can help you incorporate EDI throughout each stage of your research design, from conceptualization in the existing evidence in your lit review, all the way through to knowledge mobilization. So this is something that's really important in writing your grants, is this idea of a single EDI statement is not really something we're seeing anymore. The funders, tri-agency, as well as others, are expecting you to incorporate EDI throughout your grant application. And so these are all just some prompts to help you think about things from while you're doing your literature review, for example. So who has been included in research so far, who has not, and what does this mean for your research moving forward? In terms of study design, what measures have we taken to overcome the bias of our team members and inaccuracies when extrapolating to an overall population? Who did I consult to inform this research question? So there's all sorts of different questions that are here to help you think through what the adjudicators might be looking through and how you could articulate these different considerations you've made throughout your research. And then finally, I have just a couple of tips around other things that you can do to show that you've really thought through your EDI components in a meaningful way for health research specifically. So for example, using inclusive language. If you plan to explore all sexes, be explicit. Is there a question of why one condition might impact one group disproportionately? If so, state that and state what other questions might be going on. Is there an actual like cause and effect, or do we just know that this group is currently burdened and there's more explanation to be done, more exploration to be done, I should say. How do we know that commonly researched, or how do we know what we know about commonly researched groups compared to underserved groups? And how will your research start to close this gap between the two? Another thing that you want to be careful of as health researchers specifically is to be very specific on the factors that you're exploring and to know that you are categorizing these accurately. So for example, we stratify results in health research by race all the time. It's not a bad thing to do, but you have to recognize that race-based outcomes often indicate a social issue rather than a biological factor. There are instances when you could be studying skin pigmentation or skin color, but when you see a health outcome related to race, it's often deeper than skin color that is causing this finding. It will be something either genetic related, like you really have to dig deeper biologically to figure out what factor is causing this. It could also be a social determinant of health, like environmental exposures, lifestyles. So just being really specific about what you're exploring through an EDI lens to show the grant selection committee that you've been really thoughtful and intentional in the way that you're designing your research. Finally, collect the data. This is really kind of a call to action that you can make in your grant proposals and then in your subsequent publications, because it's counterintuitive. I wouldn't normally recommend collecting data for the sake of it, and research ethics boards won't approve that normally anyway. But when it comes to providing evidence to serve understudied and underserved communities, this might be the best approach that we have. So for example, in really small communities, so like rare disease communities, trans communities, there's different groups that make up such a tiny proportion of the broader Canadian population. It will be really hard to power certain studies based on the outcomes of those tinier populations. But if people from these groups want to participate, we should get that data and gift it to the broader community. Because one way to power studies is to include the results, acknowledge that it's underpowered for a statistical analysis, but that at least puts it out there so that these types of studies can happen through meta-analyses later on. So there's things like these that you can do that are not necessarily like, they're just any action that you're taking to help reduce the gap between well-served and underserved communities is worth including in these grant applications. Okay, moving on to research environment or team composition. I personally prefer the term research environment because it helps us focus on the process of managing labs or offices in an equitable way. I find that team composition is kind of distracting because it suggests that there's an outcome of what an equitable team looks like when EDI is really more about process than anything else, especially in how you write your grants. And I'll get into that a little bit more. But nonetheless, there are 5 federally recognized groups of people who are underrepresented in research. And that those groups are listed here. And so when you're making your research environment plans, you can use this list to help ensure that you're not perpetuating inequities within these groups. But there may be groups in your field that are underrepresented, like men in nursing, for example. So this is really just a starting point for you. The most common issue we see when we're reviewing grants is vagueness around EDI practices. So the easiest way for you to stand out from other applications is to be really specific about how you are addressing EDI. So again, come back to process. I would say if you ever have a question of how to do something, what you're supposed to be doing, always come back to process as your first step. Um, because the reviewers really want to see exactly what actions you are taking or are going to take to ensure fair hiring and an inclusive research space. The Office of the Vice President, Research and Innovation has developed a really helpful resource called the EDI Framework in Research Excellence. Um, that's on our website, and I can link that in the chat after as well. It includes some best EDI practices, both for design and research environment. It has lots of language. So if you're really just trying to think about how to phrase something, you can look through that document. I will give you a heads up that it looks like a beast in terms of page numbers. It's like 40 or 45 pages, something like that. But it's formatting. Like if you just read it from top to bottom, it takes less than an hour. So, and it's well worth it. It's a very good document that's been put together. A couple of pitfalls to avoid, like I said in the last slide, is general statements about your EDI commitment. Um, like I said, that general statement is not what the reviewers are looking for. You need to be explicit about the actions that you're taking. So this includes also talking about your own training. We'll see people say, oh, I've done XYZ training, but tell the adjudicators how you're going to leverage this new skill or this new knowledge to run your lab in an equitable way. Similarly, referencing university policies and supports is wise if you have space, but emphasize you and your team. If you have to make decisions around how to use your space, focus on what you're doing and what your team is doing instead of what the university is doing more generally. This is a common question that I get asked. And this is the type of thing where I would always say, come back to process to answer. This one's important because having a small team, you can get trapped in thinking that you need to show the demographics of your team and on a large team as well. And you shouldn't be trying to do that in either way. It's about how you manage the team. So here are some prompts to help you think through concrete practices that might be possible for your team to take. Again, this isn't exhaustive, but so if you're doing other things, include that. But things like how do you promote your positions? Are you doing it simply through the university website, or are you targeting it to find community groups that are underrepresented in your field? How do you hire? Do you prepare? Do you have somebody kind of look through the applications and prepare them to remove gender identification, names that might suggest different ethnic backgrounds. These types of things are practices that you can take to ensure that things are merit-based rather than perpetuating inequities. How do you actually run your lab and make sure that people feel safe and included? And as the leader, how do you respond to concerns around EDI? So these are the types of things that you can include. Another thing that might be asked to include in your applications is a statement of how you will measure your EDI actions. And this one will totally depend on how you run your lab or your office. But one thing for sure is that adjudicators, like I said, are not looking for demographic data. And in many cases, including demographic data of you and your research team will get your application thrown out because there are very real reasons for this. You can't, first of all, require your team to give you information about their social identities. That's their business. And there are very serious risks to collecting that data and sharing it publicly. So this is actually quite discouraged by most funders at this point. So again, focus on your process instead. Here are some suggestions on how to track and report your EDI processes. But again, once you know what you're capable of doing and what you're comfortable doing in your own space, then you can think through different measurement and monitoring systems of your own. But common ones that we see that are perfectly acceptable are things like monitoring concerns and complaints and watching out for patterns, or noting when there's a concern or complaint filed, what actually came of it. How did policies or procedures change to ensure that that was eliminated in the future? Track who has received what type of training and different opportunities to show that you're offering fair opportunities to different research team members and different trainees, people in different stages of their career, that type of thing. Have you had an accessibility assessment of your lab? When was it? When will it be necessary to revisit this? So these types of things that will sometimes make sense for one team, other times you don't necessarily need it, but you can tailor these things based on what you need in your research space. There are quite a few supports on campus available to you to help you through this thinking. So there's people like myself at the Office of the Vice President, Research and Innovation. We review award and major grant programs for EDI. So if you ever go through that process, you and I will connect again. We also have an EDI specific website on the Research and Innovation webpage that has lots of different resources in different formats that might help. I'm currently, like Alex said, compiling and centralizing EDI materials across campus. So you can watch out for that. It's going to be called a EDI and Research Center for Expertise. And that's really just to make wayfinding easier for you and to be able to find the resources you need when you need them. Within the College of Health Sciences, Alex, the moderator today, is a terrific resource. And she does things like consultations, workshops for labs, if you want to organize something like that. So I've put her contact information here. Wickery also does grant review services, which would include reviewing EDI components if there's an EDI criteria. And another fantastic resource is your research partner network. For example, they have a grant specific, so they're really in charge of grant specific workshops. And for example, they have one for SSHRC and health research next week on May, or 2 weeks from now, on May 29th from 11:30 a.m. to 1 p.m. You can find all of the workshops and different training that's being offered by the Research Partner Network on their website. They have a calendar of different training events. So there's lots of different options available to you if you need it as well. But for now, I'm happy to answer questions until 1 o'clock. And I look forward to hearing what you thought about this presentation. Thanks, everybody.
Thank you so much, Stephanie. Your presentation was fantastic. So I'll be moderating the Q&A portion of the event. I'd like to open up the floor for questions. You can use the raise hand function or type your questions into the chat. Amit.
Hi, thanks very much for putting on the presentation. Just a question about that flow chart that you had originally started with. And in thinking about, basic biomedical researchers, I'm wondering if sometimes the answer to the first question really is no, and then you have to articulate why, right?
Yeah.
Like if you're not working with patients or you're not working with patient samples and you're just working with some liquids in a tube, I'm curious, how do you have good examples of how you would craft that? I'm not sure my research would be enriched by EDI. So there's a difference between sex and gender. for CIHR, and so we do cover that. But in particular for EDI, I'm just curious if you have any suggestions on how to articulate that without making it seem like you're not considering it.
Yeah, definitely. And that's totally that is what they're looking for, is if you're in that position, they just want to see that you've thought through this. And yes, this is something that doesn't necessarily need EDI components. One thing I would challenge for people that ask this type of question is that there will always be an opportunity to talk about EDI in your research environment. So just because it's not in your design, there's opportunities to highlight the different ways that you incorporate EDI through the training environment. For the design, I would say really, and it's tricky, but really think further down the line. Like, what is this research aiming to support in the future? Like, who are you hoping will pick this up? And will they be able to pick it up in a way that is usable, and that they don't have to come back and reincorporate some type of EDI component in the future? So, you know, if you're looking at cells, are the cells, what's the source of the cells? Who and what kind of backgrounds do these cells have? Are you creating a new system to make these more inclusive, so that it's not just white male cells, that it's other people that can be represented at this type of level? Or is this kind of work, if it's liquids in a test tube, what is the hope that will come from this type of research that will close a disparity in the future? So if this is going to help make certain treatments available to rural folk, like to make them more accessible, easier for nurses or LPNs to perform rather than needing to go back to a lab in an urban center, are these the types of downstream or upstream outcomes that you're looking for? So I would say it's not just about the immediate ness, but you can also talk about the broader societal impacts that you're hoping to make. Does that help?
Yeah, I mean, the cell type thing, I think we would probably already cover through our sex and gender considerations, but the downstream thinking about it, that's a good way, I guess, to at least demonstrate you've put some thought into it. So thanks.
Yeah, no problem.
Great. We had a written question as well. I'm not sure which came first, the hand up or the written question. I'll do the written question next, and then we'll get on to Anastasia. Written question is, thanks for this wonderful and very informative presentation. Just to clarify that the EDI to grant proposal would not be a single paragraph, but incorporated throughout the proposal. Or do you recommend a specific section on this aspect?
Yeah, it will depend on, so it will depend on the grant application. If they have a specific section, then that's fine, and you can treat it as a separate section. But we're seeing less and less of that. So if you're given a choice of how you set up your grant, I would definitely say incorporate it throughout, a sentence here and there, to cover those different research phases, how you've thought about EDI during your literature review, how you thought about it or gained consultation during your design phase, how you'll do your knowledge translation so that information's available to more than just other academics through publications and conferences. That's a great way for people to think through their research design at the cellular level, or when you're talking about research that doesn't actually need to have that intersectional lens or an EDI lens or sex and gender-based analysis, but to say, we're going to make this knowledge translation more democratic by doing X, Y, Z and making it available to other people. Open access is a very easy one to kind of talk about from a EDI perspective. So I would definitely suggest going to that slide that had the different questions for different stages of the research and incorporating it throughout your grant application that way.
Thanks so much. All right. Next we have a hand up, Anastasia, if you wouldn't mind unmuting.
Hi, thanks very much for your presentation. I guess I'm also piggybacking off of Ahmed's question for biomedical research. This seemed to me more SHRC oriented, and so it makes no brainer in human research to incorporate all of these. But I will counter your logic by saying that we're actually not allowed to de-identify human cells for their origin or ancestry or any type of identifying information. It's something that we sign through the MTA or an open transfer agreement. So actually very limited amount of EDI that we can incorporate into the research design as a result of that. So it's extremely challenging to advance beyond sex and gender. Just because even in biobanks, we're not collecting where people who is donating their cells. And so it's actually extremely challenging worldwide. And I think that it's lovely to incorporate, but our hands are kind of tied a lot of times. And then the other thing I wanted to mention is that I had to write a very big application recently, and not only was it hard to find demographics for research team within the U of A, I had to knock on many doors to get that information, and it took me way longer time than it should have. But also when I reached out to societies in my fields, I never got answers about demographics, so and again, sort of, it's lovely, but what can we do when we cannot even get information from our own institution as well as the research field, right? And so how can we meaningfully incorporate these things? It's very important, but it has been proven, at least for me, to be quite challenging, actually.
Yeah, no, thanks for bringing this up. And that's one of those in the flow chart that went, have we considered this? Do we need it? Yes, no. That is one of the things, just the logistics, the data availability or lack thereof is perfectly acceptable for your justification of the no. You just need to show that you've actually thought about this. And you can also say things like, yeah, you can talk about how things would look ideally, but in this logistic challenge, this is how you have to go ahead with the research. And that's fine. They really just want to know that your justification makes sense and that you're not dismissing incorporating these things altogether.
Thank you so much, Anastasia and Stephanie. Sarish.
Hi, can you hear me?
Mm-hmm.
A little quiet, we can hear you.
Thank you for the nice presentation. So I actually have a question. If I want to integrate EDI in my past training, like researcher's contribution kind of thing. So is it for instance, I had past trainings. They were very good. I had a very good environment that incorporated EDI, many of the small elements. So can I use examples of that to elaborate on how my own program will incorporate them? Can I use specific examples, or going personal is not something that you do on grants?
Yeah. Yes, you definitely can. You want to try and the tricky thing is you don't want to get lost describing things from the past because you have such limited space to use, but saying I already have a track record of doing XYZ activities, I have this and this training, and then link it to what you're doing in the proposed research moving forward. So simply talking about being part of a committee in the past is fine, but it's not going to make your application stand out. You really need to talk about what's going to happen in the research that you're proposing. Does that make sense?
I can give you an example, and I'm playing
Sure.
with this idea. It's when I was doing my PhD, I had a baby. So I went through the process and I had great support and everything, and it helped me go through it, right? Now I have a student who has 2 weeks old. So I'm kind of helping her navigate her career with minimum kind of restrictions and limitations on her. So this is a kind of a journey, and somehow I want to incorporate that these caregiver policies, extra policies for caregivers and these kind of things that I learned in my training. But again, it's a personal journey that taught me.
Yeah.
So I'm a bit conscious to put it in the ground or something like that.
Yeah. So so there's kind of two answers to your question. The concrete one is, yeah, talk about the actual policy or procedure that you're putting in place to support new parents. That's great. There's a tendency for people to want to bring up their lived experience as somebody who couldn't overcome a barrier or who exists in one of these federally, the words just escape me, the 5 groups that are federally recognized as underserved communities. But it often comes off as fluff. And I don't want to sound dismissive of this. I totally understand why people do it and the urge to say that I connect with the communities that I'm working with and working for. But the space is better used to talk about what your actual actions are going to be. So it's just one of those things where when it's written down, it just isn't as valuable as talking about what you will actually do. So whether or not you're a mom or you have faced these barriers in the past, the actions that you're taking to break these down in the future are much more compelling for the grant reader. So that's why I say this. Does this all make sense?
Yeah, it does. Thanks. Yeah, it does.
Yeah. Angela?
Thank you so much. Yes, Angela.
Thank you so much for the presentation. My question is quite related to what you just mentioned. So I do community-based research. And so the topics and the directions we go in are very much decided by the patient group. And we kind of, so we kind of have that aspect of EDI very much built in and into the plan from the very beginning. But I do find it a little bit hard to communicate that piece and ensure that that's really understood, that this really is kind of the gold standard, as you could say, in terms of incorporating EDI into the topic. But I do find it difficult to kind of walk that line between like what might sound like fluff, that kind of thing that you're talking about, like the lived experience, and really clearly communicating that we are kind of doing this to the highest standard possible.
Yeah, I'm a community-based researcher as well, and I know exactly what you mean. I think that community-based research it has become a really common approach. So it won't be enough just to say that you're doing community-based research to show that you're doing EDI. So you'll want to say things like, are you compensating your patient advisory board or whoever has been doing the advisory? How did you consult? How did you conduct those consultations that informed your research question to make sure that you've got the broadest perspectives, the broadest diversity of perspectives, giving you that feedback? What will you do to promote your findings to different communities, the relevant communities? Like if it's policymakers and like folks in industry or healthcare providers and patients, what are the different knowledge translation products that you can develop to meet their needs? So that's why I think really thinking through the whole research process is helpful, because you can say, how will we re-engage these folks? And you can talk about the ways that you reduce barriers throughout. It doesn't just need to be in your research design or in how many interest holders joined you or anything like that. I think that a lot of adjudication committees have a more advanced understanding of EDI than that at this point. So really talking about the specific actions you'll be taking to include people either as your research team members, like direct research partners, or as an advisory board, or just to inform later. But yeah, it'll be about how you talk about those specific actions. I've put links into the chat for that document developed in the VPRI, Vice President Research and Innovation, and the flowchart. And the flowchart one is nice because it has a lot of more questions that you can ask about how did you get the team that you got? How will you represent the Canadian population in your research design, like in the participants that will be included in the research? So there's things like that in there that might be able to help you as well.
Yeah, thanks so much for those suggestions.
Faye.
Hi, thank you, Stephanie, for the informative presentation. I have a question about measurements for impacts, specifically for New Frontiers grants. They ask about how you measure the impacts of your policies related to, for example, especially when it comes to team composition, since we can't ask team members those questions, how do you measure the impact specifically related to team composition?
Measuring impact. I would say that it's more going to be about, well, often you can turn to process again, rather than looking at impact. So you can say our processes have been, so like if you adopt if you put together a protocol for your lab of how people are going to behave, a code of conduct, and then you can say X number of colleagues have adopted this practice since we have talked about it, or we have presented this process to these different EDI committees as suggestions for other researchers to adopt. So you can talk about how you've changed policies and processes as an outcome and as a process kind of indicator. You can talk about how you hired your different staff. Again, you don't want to include demographics, but you just want to show that you are keeping track of your job promotion and then your subsequent hiring protocols to say this, to prove that it's merit-based, basically. That this isn't affirmative action, which we've never been in the business of doing, but that's where the problem with this focusing on demographics can go, is people really start thinking that this is affirmative action rather than being a merit-based process that you're trying to incorporate. And then when it comes to the completion of the research, if you've incorporated EDI into your different phases of your research, you can say, one of our goals was to create evidence around children's expression of this condition, and we did that. That evidence didn't exist in the past. So you can bring those types of EDI outcomes as well, just in the evidence that you've created. And then in knowledge translation, how did we mobilize that evidence and disseminate our findings to the right groups? How did we identify those groups, and who got the message, and who's followed up for future research, that type of thing. So it's really not about the demographics of a team. It's about how are we changing the way that we work to break down barriers for people to have equal success, opportunities for success. Does that help?
Yes, it makes a lot of sense. Thank you, Stephanie.
I don't see any more hands up or any other questions on there. I think Katrina is the only one somebody could send a anonymous note to, I believe. So just in case if there's been any sent to you, just in checking.
Yeah, nothing's been sent to me.
Oh, sorry.
Right.
I haven't received anything, so.
Okay, great. Just wanted to double check.
I've put my contact information in the chat. So if anybody wants, if something comes up and you want to ask a quick question or have a further chat, I'm around. So I'm always happy to talk about EDI.
Okay, maybe just give it another minute or so for any last folks furiously typing their question in there. I'll put my email in there as well. Okay, well, just while we wait for those last couple of questions, just want to thank you again, Stephanie, and to everyone who joined us today. Those who register will get an email in the next few days with a link to the video, and you'll also be able to find it under the events section on the WCREAD website as well. So I'd also like to say thank you so much, Stephanie, and
No,
really appreciate all this wonderful knowledge and expertise.
no problem. I see there's like one big question that just came up that I'll touch on. how significant EDI considerations for Indigenous health research. So this one is, of course, if you're doing Indigenous health research or research that intersects with Indigenous communities, you need to connect with those communities. And this is a really long process. So when I get this question about grants, it's the first thing I always say is, if you don't have these partnerships in place already, the grant is not ready to be written. So your time will be better spent learning about the process behind Indigenous community engagement, and then working with them to write up what the actual report will be, what their role will be in it, your role will be in it, Indigenous data sovereignty. Like, there's all sorts of things that are really specific to doing research in that community, in those communities. So yeah, I won't get too much farther into it in this presentation, but there is lots of expertise around campus. My first suggestion would be connect with somebody in your department or in your faculty who is doing these types of Indigenous engaged research, and talk to them about the process and decide, is this something that makes sense for me to undertake, or can I support decolonizing through other ways, like using Indigenous methodologies rather than connecting with community. There's different ways that you can support reconciliation that way. So yeah, more than happy to help if you have further questions with that. And thanks, Alex, for the very friendly send-off. It was an absolute pleasure to be presenting with this group today.
Great. I'll switch. Maybe leave it open for a little bit here, just while folks are signing off, in case it's in the last minute, if anybody wants to stick around. I sometimes like to turn the recording off for the last couple of minutes, just in case there's somebody who had a question that they didn't want on the recording. I don't know if is that
Sure, let's do that.